Joining us now is Dr. Megan Ranney, an emergency physician and dean of Yale School of Public Health. Doctor, thanks so much for being here with us. Knowing what we've been told about the Pope's condition, what are you gathering from this now news of mild kidney failure, what that might mean and what you would be looking for?
Well, the mild kidney failure is certainly not a good sign at this point, over a week into his hospitalization. But I think the really important point, Jessica, is what you just said, knowing what we've been told. The information that we are getting about the Pope's condition is clearly incomplete and sporadic. So it's difficult to know for sure what's going on. But adding in kidney injury on top of a double pneumonia, on top of anemia that required a blood transfusion reportedly. He supposedly got 2 units of blood. And on top of what seems to be an ongoing oxygen requirement, it's not a good sign. It implies that his body is having trouble either getting adequate blood to his kidneys, or the kidneys are being injured by the infection themselves.
Mm. And so as a doctor, what would you be looking for next?
So I'd be looking for a couple of things. The first and biggest thing is seeing how his breathing is doing, trying to get him a bit more comfortable, get his oxygen levels better. That's the first. The second is looking for signs of infection. Is he still spiking fevers? When I check blood tests, do I find signs of inflammation? There are some specific tests that we can look for to see how his body is reacting to the infection and to signal whether he's moved into sepsis. And then the third thing is looking at all the other organs and systems in his body, his kidneys, his liver, his blood counts, both his red blood cells and his platelets, both of which have reportedly been abnormal. And I'd be checking all of those things regularly, right? So you measure blood pressure and heart rate and oxygen on an ongoing basis. You're doing blood tests at least a couple times a day for someone as important as the Pope. And then you keep treating and you watch how he responds to treatment. But it's certainly touch and go right now, which is why they're still calling him critical. No one's saying that he's dying, and I hope to goodness that he's not, but it is certainly touch and go for these next few days.
Yeah. And look, just a reminder to everyone, he is 88 years old. He's had a number of health issues in recent years. He also had part of his lung removed many years ago. That complicates all of this.
It absolutely does. What is a mild problem for someone who's in their 20s or 30s and is otherwise in good health becomes very serious for someone like him, who's had repeated lung infections over the years, in addition to having part of his lung removed. But to my knowledge, this is the longest that he's ever been hospitalized and the most severe hospitalization. And again, a lot of the signals that are coming out from those Vatican reports are really concerning. They've said that he has multiple organisms in his lungs. And again, kidney injury on top of all the other treatments that he's been receiving is just not a great sign.
Yeah. So at this point, I think it's safe to say, based on your analysis here, it is touch and go, and we now just have to wait and see if his body can kind of respond to some of these treatments and start improving.
That's exactly right. He's clearly receiving all of the best medicine, all of the best care. I have no doubt about that. The question is whether his body is going to be able to recover, even with getting antibiotics, steroids, blood transfusions, oxygen supplements. That's the part that's hard to predict.
Right. We just have to wait and see. All right, Dr. Megan Ranney, thank you so much for walking us through that. We appreciate it.
Thank you, Jessica.